So to do a prone cervical adjustment, index pillar push prone, okay? You might hear it described that way. I'm going to set up a pivoted stance. I'm going to be close to the table. I want to turn my shoulders parallel with my patient's shoulders. I'm going to make my contact on the LPJ. Turn your face to this side. Good. And lift the chin up just a little bit. Okay. My support hand is going to be on the mastoid process. So we're going to have a thenar contact on the mastoid process. Spread my fingers out. Okay. And I'm going to support just like this. Okay. And the thrust is going to come from the pectoralis muscle. Okay. So I'm going to stand pointing towards the head of the table. It keeps my arm close to my upper body. So let me looking at that. You want to make sure that your arm is close to your upper body. The line of correction is going to be P to A, I to S. Okay, and it's just a light thrust. Okay, we can use a drop with this. What do we eliminate when we use the drop? We eliminate pre-stress. Okay, so we're going to utilize pre-stress. Or when we eliminate the pre-stress, okay, we go from a light touch to a full drop. Okay. How about an AS and a PS occiput? Okay, let's just kind of stick with the prone setups. So AS occiput. Okay. So what we're going to do is we're going to have the patient in the prone position. We're going to have them tuck their chin. Okay, so they'll pre-position, right? Take out any of that slack, that joint slack. And our contact is going to be behind the mastoid process. Okay. This is a thenar contact, just like this. And I'm going to grab the patient's head. I'm going to have my elbows in. Again, I'm going to turn my body so that my shoulders are somewhat parallel with the patient's shoulders. And for an AS occiput, okay, I'm going to stand back. Okay, we have an AS occiput. We want to thrust P to A and I to S. And so we're going to step back in our stance a little bit. Okay, we'll set the drop, and we're going to thrust this way. So our thrust is going to be like this. Okay. For a PS occiput, I'm going to have them lift their chin up just a little bit, and I'm going to move up in my stance. And I'm going to be behind the mastoid process, the same contact, okay? But I'm going to be over the segment somewhat because my line of correction is going to be P to A and S to I. Okay, so I'm going to rock the occiput this way. It's an arcing motion. Okay, to make that thrust. Okay. Okay. Can I mix cervicals, thoracics, lumbars? Can I do that? Would that be okay? All right. So in the thoracic spine, what setups do we do in the thoracic spine? Cross pisiform. So cross pisiform is done down through T10, okay, through T10. What do we do in the upper thoracic spine? What are some of the setups that we do? Thumb and the pisiform move. Okay, so let's do a thumb and then a pisiform move, and we'll talk about the modified. So a thumb move is you're going to stand on the side of spinous laterality, okay, and so I'm going to have that same pivoted stance. I'm going to make my contact on the lateral aspect of the spinous process. Make sure you grab some tissue, between you and the spinous. Okay. We're going to ask the patient to turn their face to the opposite side. Okay, lift the chin up a little bit, and now I'm going to support here. You can support just the way you did on the mastoid process. Okay, if you want to, you can get that thenar as close to C7. Okay, if you're contacting T1 as possible. Okay, I tend to just support at the mastoid process and stabilize the patient's occiput and cervical spine that way. So our thrust, again, is going to be lateral to medial. There's a little I to S because of the shape of the facets and whatnot. Okay. So that would be a thumb move. Put your face back to the center. Pisiform move is going to be where we place the pisiform on the spinous process. Okay. This would be for a PR listing. Turn your face to this side. Okay. And I'm going to support, and the pisiform move would be just like that. Modified, I'm going to stand on the opposite side. I'll just stand on this side, just easier for you guys to see, but this would be for a PL listing, okay? When you do the modified, just take a step forward, just easier to get on the contact and position your body correctly. So I'm going to make my contact against the spinous process just like this, okay? What direction should they turn their head?
Towards you.
Turn their face away from the side of contact, and so this would be for a modified thumb move, okay? Modified pisiform move is where we place the pisiform against the spinous process, and they'll turn their head, okay? And this will be a modified pisiform move. When you're doing these setups, just be careful not to be on the TMJ. Try to get on the mastoid process, okay? And again, if you're going to support C7 when you adjust T1, just get that thenar down to as close to C7 as possible, okay? You don't want that to, your support hand to interfere with your adjusting. Okay? So, what what are the other moves that we have for the upper cervical spine, upper thoracic spine, upper thoracic?
Single hand.
Yeah, single hand, Gonstead single hand contact. So T1 through T3, I believe it is. What hand do I use? So single hand contact. Okay. So I'm going to use my inferior hand. Okay. Inferior hand, pisiform contact. This would be for a PR listing. Okay. I'm going to have a square stance, and I'm going to make my contact on the spinous. So I'm going to be actually on the spinous process. Remember, we're going to lift the spinous. We're going to lift and we're going to thrust through the plane line of the disc. Okay. And so this is going to be our contact, just like that. And we're going to have some P to A, and we're going to have S to I in our line of correction through the plane line of the disc. So we're going to lift the segment, okay, and then we're going to thrust. So that's a single hand contact, spinous contact. We could also do a transverse contact, okay, a dash listing. Okay, we're going to make our contact, okay, and we're going to lift, and then we're going to thrust through the plane line of the disc. So we can use a thumb and a pisiform contact down to about T2, about T3. We'll use our cross pisiform. Okay. And the way we're going to do that is we're going to have a pivoted stance. We're going to make our contact on the posterior transverse process, which is going to be on the side opposite spinous laterality. So we'll make our contact, and what I do is I do a tissue push, okay, up and out. I want to get any of that tissue slack out of it because I'm going to have some I to S in my line of correction. And so I'm going to go from the spinous up and out to the transverse process, and I'll do that with my contact. And you just slide your contact and get some of that tissue slack out of there. My finger should be pointing towards the superior. Okay, I need to have a relaxed arch. Okay, so we're going to have a pisiform contact, but you don't have to make us have a real sharp arch with our hand. I usually like to have a relaxed arch, so I have more of my hand touching the patient. So we're going to make a pisiform contact on the transverse process, find the transverse process on the opposite side, and we're going to place a support hand, okay, on the opposite side. So my hands are going to be in this position. Okay. So this is going to be my contact here, okay, and my support. And so my thrust is going to be P to A, okay, with a little I to S. Okay. When I get down to the mid-thoracic spine, I might come back a little bit because I have a little bit more I to S that I want to put into that thrust. And in the lower thoracic spine, I'm going to step back even more. So at T10, I'm going to have even more I to S, simply because of the orientation of the vertebrae in the kyphotic curve. So at T10, okay, go like this. Okay, I'm going to stand back just a little bit, and so my thrust is going to be P to A and I to S. Okay, most of the force is going to come from the adjusting hand. Okay, support hand is just going to support the opposite side. Okay. How about torque? Think about this, torque to close the open wedge. Okay, so if I have a PRS, I'm going to torque clockwise. If I have a if I have a if I have PRS, I'm going to torque clockwise. Okay. If I have a PRI, I'm going to torque counterclockwise. So I never remember clockwise, counterclockwise, that type of thing. So what I like to do is just think about the open wedge, and I'm going to torque to close the open wedge. Okay. So in the thoracic spine, cross pisiform. Okay, PLI, I'm going to stand on the right side. Okay. I'm going to contact the right posterior transverse process, and I'm going to torque to close the open wedge, which happens to be clockwise. Okay. Torque in your contacts, okay, with the thoracic. So if I'm going to do a PLI, I'm going to torque in my contact. So I'm going to torque my contact in, torque in my contact like that. Okay. When I make the thrust, I'm going to torque from the top of the thrust to the bottom of the thrust. Okay. Both hands will be involved in torque. Okay. All right. So we have single hand contact in the thoracics and lumbars as well. All right. So from T3 down to L3, what hand do I use? So P is the superior hand, right? I'm going to have a squared stance. I'm going to have a pisiform contact on the spinous process. Okay. This is going to be an arch. My fingers are going to cross the spine. I'm going to support the wrist with my opposite hand. I'm going to lift the segment, okay, and I'm going to thrust P to A. Okay. I'm going to thrust through the plane line of the disc. So T6, for example, okay, I'm going to lift the segment. My thrust is going to be straight P to A. Okay. At T10, I'm going to lift the segment. I'm going to thrust through the plane line of the disc.
Do you have more of a relaxed arch for these?
I do have a more relaxed arch, yeah.
Okay.
Yeah. You could do both. You can have a real sharp, we do that real high arch because we want to get that pisiform sticking out so we can get on the atlas TP or the posterior arch. But I have a more relaxed arch, a little bit more of a flat hand contact because it's a little softer contact on the spinous process. So yeah, good. So, okay. How about for a TP contact? Okay, my fingers are going to be parallel with the spine. Okay, I'm going to make my contact on the transverse process. I'm going to support with the opposite side. I'm still going to lift and I'm still going to thrust through the plane line of the disc. Okay, what's different? Yeah, I'm going to scoop. What I'm going to do is I'm going to push against where the spinous and the lamina meet. Okay, right here. Okay, I want to direct that force through the body of the disc, and that's what the scoop is. Okay, and so what you do is sometimes referred to as exposing your pisiform. Okay, and so you're just going to thrust and just angle your hand down. So what that does is it directs that force through the body of the vertebrae. Okay. How about in the lumbar spine? I can do my single hand contact, and what hand do I use? Yeah, I'm going to use my inferior hand. Right? So inferior hand contact on the spinous process, and again I'm going to lift the segment, okay, and then I'm going to thrust through the plane line of the disc. Okay. So, all right, you guys got that. What are some of the other thrust setups that I do in the thoracic lumbar? Thenar, yeah, double thenar. So I'm going to use my double thenar. Okay, double thenar from T11 through L5. Okay. So at T11, I'm going to have P to A and I to S in my line of correction. Okay, and so a double thenar. What side do I stand on? Yeah, I'm going to stand on the side opposite spine. I'm going to stand on the side of spinous lateralis. So PR. Okay, I'm going to stand on the right side. And so this is the long lever. This is where most of my thrust is going to come from, which is the posterior mammillary process. So I'm going to plant that hand first, okay, and then I'm going to support the opposite side. Okay, I'm going to turn my hips into the table, and my thrust is going to be mainly on the posterior mammillary process. So if I have an open wedge, I'm going to torque the open wedge open or closed. I'm sorry, I'm going to torque the open wedge closed. Okay, so if I have an open wedge on the right side, okay, I'm going to torque to close the open wedge. Okay. So my position for T11 is like this. For L3, I'm going to move up in my stance like this. So my thrust is going to be directly P to A. Okay. For L4 and L5, don't forget we're going to pivot. Okay. And we're going to make our contact like this. Okay. So, okay. Good. What else in the thoracics and lumbars? Toggle. Okay. So toggle, we're going to get on the spinous process, and I think, correct me if I'm wrong, we always use our superior hand when toggle. Is that correct, or is it the superior hand? Yeah. And so toggle is on the spinous process. All right. And so we're going to make our contact. Okay. And we're just going to thrust with our toggle type of thrust on that spinous process. Okay. So, all right. Let's get to the cervicals, and I want to finish up the cervicals, and then we'll go back to pelvis and maybe do some side posture. So, any questions up to this point? Questions? It's all familiar to you guys, so this is just kind of getting a visual on this again. So, yeah. Questions?
Is there a single hand thenar?
Say again?
Single hand thenar.
Oh, single hand thenar.
Yeah.
So the double thenar is diversified, and the thenar, the single thenar, is Gonstead. Okay, and Gonstead the single thenar will be like this. Okay, you're going to thrust through the plane line of the disc. Okay, and which side do I stand on? Stand on the opposite side of spinous lateralis. Yeah. So for a PL, I'm going to stand on the right side. Okay, and the difference is that I'm going to thrust through the plane line of the disc. All right, with a Gonstead thenar contact. Okay. It feels a little weird in the lumbar spine, doesn't it, to do that? It's the opposite side. Seems, what table does Gonstead do his lumbars on? Well, he doesn't side posture, but what? Doesn't need chest table. Yeah. So the patient is positioned differently, and the doctor is positioned